I'm Dr. Deol, and this is Deborah Lesko. Deborah is one of our patients at Center for Vascular Medicine, and I'm just going to talk to her a little bit about her story and how she ended up with us.
Dr. Andari, my OBGYN, referred me to you because I was in severe pain. He actually tested me for ovarian cancer. I thought,
Seriously?
yes, I thought I was in big trouble. I was in so much severe abdominal pain.
Okay.
Yeah.
And you also had varicose veins on both legs.
I did, yes.
And remind me, you had those treated in the past?
I did, 16 years ago and 7 years ago, but it's a chronic problem. It's hereditary, and I've had 9 children, so they have been stressed.
Yes.
Yeah.
9 children. All right. And then during that time that you had those 9 kids, did the varicose veins get worse?
Definitely.
Both legs?
Yes.
Is one leg
My
worse?
left leg is much worse.
That's
yes.
right. Okay.
Yes.
You know, I don't know if you remember this. You told me something. You compared yourself to an animal. Do you remember telling me with a thorn?
No.
You told me you were a lion with a thorn.
Oh, lion with a thorn in its paw.
Yes.
Yes. I was so ornery and irritated, and it was dragging me down. Yeah, it was dragging me down mentally too.
Okay.
Yeah.
And what had your OB-GYN done as far as your pelvic workup to see what was happening in there and what was causing your pain?
He just ran me through the battery of tests and blood work and that. So no, he referred me to you to get the ultrasound, find out what was going on, and I couldn't get my legs taken care of until I took care of the pelvis because of the severity of what was going on deeper.
Yeah, absolutely.
Yeah.
So we took a look at you here at Center for Vein Restoration,
Yes.
and then we went over to Center for Vascular Medicine to look further into your pelvis.
Right.
And do you remember what I described to you as the options as far as treatment goes when we did find out that you had a pelvic vein, your left side being worse than your right, was being squished by your artery? So we had some options. We could either watch it, or we could go ahead and take the next step where we look inside that vein with a camera in the cath lab and see truly what is happening there. And what went through your head when I told you about going to a cath lab?
Right. I was just so happy that there are treatments, there's technology that's caught up to what's going on, because I never heard of pelvic congestion. I didn't know what this was, and the fact that there was actually an answer, something that could be done, I was actually thrilled and scared at the same time because I'm not a fan of veins.
I remember we were just talking just now, and I didn't remember that. I remember the first time I was showing you your ultrasound.
I'm so squeamish.
Yeah, no, it's okay. It happens. But talking about treatments, I thought, wow, I didn't know if we were going to be able to get your pelvic venous scan, number one, and number two, if we did, could we treat it?
Right.
Did you have the same fear, or were you too anxious about getting it done that you didn't think about how squeamish?
I'm always very hopeful. I have a positive outlook. I was very confident that I was in the right place, that I got channeled where I needed to go. And I felt really confident that, yes, I don't have to go out to another state. They have something in Michigan to help me. That's what I wasn't sure of. I'm going to get help here.
Right.
So the fact that it was local, I was really excited.
Yeah.
Yes.
Well, cool.
Yeah.
So, you never passed out. You didn't get white when we did the pelvic scan.
No, I was determined.
You were determined at that point. Yeah. Your whole demeanor had changed, I think. By the time you ended up there, you had more hope, probably.
Yes.
Okay, that's what it is.
Yes.
We now have made the decision to go ahead and look at this a little further and go into the cath lab. I tried to prepare you the best I could for what you were going to feel in the cath lab. It's like you just said, it's not a cakewalk.
No.
So the biggest things that I'm going to tell you. You go ahead and tell me. What was your experience like in the cath lab?
So everyone was extremely personable and wanted to know that I was comfortable. I was given enough of the sedation and the pain medication so that I was comfortable. I didn't have any anxiety, which I do struggle with some anxiety. And I was put at ease. I was very pleased with that. And I was told what to expect at each step of the way, so there was not a surprise. And having 9 children, I know a little bit about deep breathing, so I did my deep breathing. And compared to the pain that I had, that I was experiencing, it was worth it to know I was going to be on the other side of it.
Got it.
Yeah.
So it was painful, it was uncomfortable.
Right.
But again, knowing what you were headed towards,
Yes.
it was worth it too.
It was worth it,
Okay.
definitely.
What about your recovery in that week after? What was that like?
The first 5 days, I would say, was the highest intensity. I was using hot packs, and I got a call from the nurse. Yeah, I was taking their opiate. I can't remember the exact name of the medication. Percocet.
Yeah.
And yes, I needed that the first 5 days, but then I weaned off of it. And instead of taking the 2, I took 1 and weaned down from it. Within 2 weeks, I was back to normal.
Where was your pain mostly? Was it in your belly or your
Lower
back?
back. Lower back. Lower
Okay.
back. I was using the hot packs or the heating pad
Okay.
back there. Yes, lower back.
So this is what I tell patients, and you can tell me if I was correct. I
Okay.
usually say it's like 3 to 7 days of back labor.
Yes.
Is that what it was like?
Well, I would say yes, comparable.
Yeah.
Comparable, yes.
Okay.
Yeah.
And then after 5 days for you, you weaned down.
Right.
And then let's see, I saw you back at your 1 month visit.
Mm-hmm.
How did you feel at your 1 month follow-up?
Wonderful. Yeah, wonderful.
Okay.
Huge improvement from a level 6 pain down to a 3.
Down to a 3.
Yeah.
Perfect.
Yeah.
And then I just recently saw you for your 3 month follow-up.
Right.
And to me, you look like a different person. You
Yes.
came in there all smiley.
Yes.
Do you want to say why?
I'm dating somebody.
Yay!
Yeah, I'm
Yeah.
excited.
Somebody that you met after
Right.
we had first met and started
Right.
talking about this.
Right.
So to me, you looked like everything had changed
Right.
for the better.
Right, right. Going forward with life and just feeling that hope that I'm, going to start a relationship. So yeah, I was very excited. Yeah.
I love it.
Yeah.
Yeah.
It's a good success story all the way around.
Anything else that you want to tell people?
Mm-hmm.
Good, the bad, if I had to do it over again, or
Yeah.
anything that
Yeah.
you just want to say that I'm not asking.
Well, I can tell you that I was given personal care from Lena at the front desk, the nurse Debbie, Heather, the one that did the ultrasound. I mean, right away they really cared about me, not just as a patient, but on a personal level. So it really boosted me to feel very confident. And I was having some issues in my personal life, and they gave me a hug and were very kind. And wow, I was very, very impressed all the way around.
Well,
Yes.
you are. You're like our
Thank you.
family. So
I
thank
appreciate
you.
it.
Thank you
Yeah.
for talking to me today.
Yes, absolutely.
Thank
Thank you so much. Bye-bye.